The second annual I Am Her Feminine Hygiene Drive, supporting young ladies from Ghana, Africa in need of everyday essentials and feminine hygiene products, was a great success. Thanks to the generosity of our community and organizations like Period.org, Muskegon Heights Public School Academy, Confident Cosmetics, Muskegon Heights Alumni Chapter of Delta Sigma Theta Inc., and everyone who made a contribution. Hundreds of young ladies and village members received essential items. The community made a lasting impact with more than 10,000 sanitation items donated. If you would like to help, donations can be made year-round by dropping off items in the donation shed at the Mays and Wright Media Center, located at 1877 Peck Street, or making a contribution to paypal.me/1037thebeats. For more information, call 231-727-5007. Thank you for supporting I Am Her Foundation.
And welcome to the show, family. And shout out to Healthwest, Big Rob, because they did help us out. I think it's been 2 years ago when we started this I Am Her campaign, making sure we got backpacks to the kids in the village. So shout out to Healthwest.
Absolutely.
And today, from Healthwest, the one and only Michael Pyne joins the conversation. We're talking about Black mental health here in West Michigan. Mike, how you doing today, sir?
I'm doing good. It's good to see you guys. It's been a long time. I missed you guys.
Yes, I miss you guys too, man. You living good. I see the nice scenery in the background there, way out there in the suburbs, man. Life is good, man.
Yeah, I'm out in the woods. I'm out in the woods in the middle of nowhere.
Nothing wrong with that. Nothing wrong with that.
But you know, I told you earlier, if I turn this direction, it's a hot mess. So
it's a hot mess. Hey,
I'll be honest.
I can relate. I definitely can relate. Hey, Mike, there's been a lot of stuff that we're dealing with here in the Black community. Still, COVID deaths, COVID-related deaths in the Black community in Muskegon, in spite of the fact the numbers are dropping overall. Still, we're seeing these spike in gun shootings. And so I wanted to get you on to talk about some of the services Healthwest has available to deal with some of the crises that we are facing.
Yeah, and you know, you mentioned these two topics, and certainly we've all heard about it, and I'm certainly aware of it. Our agency is definitely aware of it and working to help as much as we possibly can. And I don't want to add another layer of trauma or stress or difficulty to things, but also, you know, during COVID, you know, I've been the suicide prevention guy for a while, right?
Right.
And throughout COVID 2020, we saw a pretty serious drop in suicide rates across the nation. The numbers are back like they dropped like what they were 5 years ago. They've been steadily rising, except in the African American community where they rose. And I think a lot of people aren't aware of that either. So these additional stressors, I bring that up to because these are all areas that we need to pay attention to.
Are you seeing that increase in suicide locally?
Well, I have to say from probably 5 years ago, we're not seeing it as dramatically as what they are seeing it in other places in the country. It's especially going up within the African American youth community. But we are seeing more consistently year after year, we are seeing deaths in the community amongst African American community members. The numbers are still down. We're trying to stay out in front of it, but I bring it up because it's one more thing to pay attention to as well.
Because, you know, a lot of times when it happens, the community don't know because it generally don't get reported on. So it is still going on in the Black community here in Muskegon.
And increasing dramatically.
What about attempts?
That's probably where the indication is the biggest, even among adults, by the way, right? Because adults in the African American community, historically, this has been kind of a older white guy problem, is what people think. It obviously touches all communities, all races, all cultures, and all income levels, right? But even among African American adults, those attempts are starting to nudge out their non-African American counterparts in America. And the same is true, obviously, for African American youth. So the attempts are probably what we see the most of course. And So it's just, again, I really hate to be the bearer of bad news, the suicide guy, but I do also want to take the opportunity to make certain these other stressors, like with COVID, traumatic experiences that people are having, when people begin to struggle and with trauma and perhaps then mental health concerns and depression comes in, there is that risk too that people could be thinking suicide, and it's okay to have those conversations with each other out there.
In regards to suicide, what are you seeing as some of the triggers? What is happening that maybe we're not paying attention to?
This is always the question, isn't it? The question is always why. If we lose somebody to suicide, the question is always why. And what we do know is it's multifaceted. It's usually never just one thing. It's usually a culmination of things that pile up, and then there is maybe the straw that breaks the camel's back. So I mentioned during COVID, suicide rates have gone down, except for in the African American community. And historically, with epidemics, pandemics studied in South America, Asia, the African continent, suicide rates do go down during a pandemic or an epidemic. But after the threat of the pandemic has passed, we see a spike in suicide. So, and this goes back to 1918 with the Spanish flu. Even the research goes back that far. So we have a good amount of data on this. And what we want to do is, as the numbers are down, we want to capture those and keep them low. And if they've gone up in the African American community and there's a risk that there could be a spike after the pandemic, we want to make sure that people are aware of that, reaching out to each other, having these hard conversations with each other in order to try to capture those and keep them down.
Okay, so, wow.
Yeah, sorry.
So we got three issues right here. Healthwest deals with all of these issues.
Yeah. And, I'll start kind of with the COVID thing too. And there's other community partners I want to talk about here. Actually, let me start with Healthwest and the things that we can do. It's first, I want to say that sometimes taking that first step to reach out for help, especially if you're doing it on your own, it's really difficult step sometimes for people to self-refer to get the kind of help that they may need for support after a trauma, maybe a mental health concern, etc. And I just want to let people know that with one simple phone number, you can reach Healthwest, and there's all kinds of ways that we can meet you where you're at. So we can come to you in the home, we can meet in the community, we can have you come to us, we can do it over the phone, we can do it through Zoom or through technology. It's not as if there's just one way. We can do this all kinds of ways, whatever you're most comfortable with. And so the phone number that I want to give there is it's 231-722-HELP, H-E-L-P. If you call that number 24 hours a day, you're going to reach us. And,
can you say that number again?
Yep, 231-722-HELP, H-E-L-P. And you're going to get somebody at Healthwest. So there are a couple of levels here. If somebody feels as though that they need some help with perhaps a mental health concern, they can call and ask about getting an assessment done. Also, substance use concerns, they can call that number and ask about being assessed. If somebody feels like they just need to talk, if somebody has experienced a traumatic incident, especially around the shootings and the violence within the community, this is obviously very traumatizing. And trauma is something we also need to work with as soon as possible. If you call that number and maybe you don't feel as though you have some big mental health concerns, and you don't have to, you can just call and we can have a conversation. Doesn't matter about ability to pay, insurance, whether you got the Cadillac of insurance or no insurance, we're going to talk with you. And if you do want to go on for an assessment, or you do feel as though you want to be assessed, we can also do that regardless of ability to pay, regardless of insurance.
Wow. Go ahead, Big Rob.
What other services besides the suicide prevention stuff? I know you do. What about those that's dealing with depression real bad, that maybe they don't know, they're too depressed to even reach for a phone?
Sure. And that's a tough one. That's a real tough one. And sometimes, like I say, taking that step or self-referring can be really difficult. This is where, first and foremost, I just want to say, We got to reach out to each other. We've got to have these conversations where we're checking in on each other's mental health and where we're at. And I'll give you the criteria. If you're struggling with a mental health concern is going to impact your thinking, it's going to impact your behavior, and it's going to impact your emotion. Those three areas. Then it's going to impact your ability to focus on work or school. Where you're just not able to kind of focus real good. It's going to impact your ability to take care of your day-to-day needs, right? Taking a shower, taking care of the dog, taking care of the household. It's those things are going to be probably more difficult to do. And then it's going to start to impact the relationships you have with people around you. When these areas are impacted, right? Our relationships, our ability to take care of our day-to-day needs, our ability to focus and concentrate, when that goes on for 4 weeks or 5 weeks, it's time to reach out and get some help. And what I can tell you is, like with depression, Rob, the average American is going to wait 11 years before they reach out for help. 11 years. And I just said to you, if you're experiencing those situations, it's 4 or 5 weeks and you should be reaching out for help. We don't really do that in America, and we don't do that in, certain cultures and in the community. And we have to start to break down that stigma and encourage people to reach out. And not every phone call, too. People are sometimes afraid to call because they think it means a trip to a psychiatric hospital. And I can just tell you, more often than not, that is just not the case. It's more about getting in touch with services. And the earlier that you reach out, the better the outcome is going to be for your health. Not just your mental health, but your physical health is going to be impacted by all of this too. And this trauma impacts our physical health as well as our mental health.
Mike, sometimes for African Americans, it's hard to open up to people that don't look like them.
Yep.
Have Healthwest became more diverse where people can get help from folks that look like them?
I know that we are working harder probably than we have in my time. I've been there for 19 years, and I don't want to suggest that maybe we weren't paying close enough attention to over the years, but I do feel of late the attention has really been focused in there. So, we've got Mickey. I think you're aware that Mickey is working on diversity and inclusion in our agency, which means we have a dedicated staff position to this. We're working really hard to recruit and retain employees so that we look more like the community that we serve. And I do feel as though we're beginning to meet those. I mean, it's just an important thing to do, right? Every health agency, every agency out there, organization should really look like the community that we serve. And I think we're there. And most certainly this helpline number that you have up there, it's a very diverse group of folks who answered that line. If somebody answers that line and you feel as though maybe you're not the most comfortable with that individual, it is perfectly okay to say, is there somebody else I might be able to talk to? I wouldn't worry about that too much. I would just let it be known who you might be most comfortable speaking with.
Is that line open like in the middle of the night?
We're working hard to make sure that line is answered by our employees 24 hours a day in-house. Right now, we're in a transition phase. We're beginning to hire to make certain that it's answered 24/7. And at this point in time, after hours, like in the middle of the night, you can still call that line and you're going to get connected with master's level clinicians and people who can address your concerns. And if you're in a crisis situation, they are going to forward that on still to Healthwest employees, whether that's middle of the night or not, and people are going to respond. And to the extent where, if you're, especially with youth, I want to talk about the Youth Mobile Assessment and Stabilization Team. If you call that number in the middle of the night, even 24/7, you call that number as a young person in the community, or a parent or a grandparent, and you have somebody who's a young person, that is going to get connected to a master's level clinician, a therapist, and another social worker, and they are going to reach out and they're going to do a full assessment. And we're talking a full psychological assessment, safety planning, everything that needs to be done. So that's like an hour and a half. And they're going to also come to you where you're at. So it's not a situation where in the middle of the night, you've got to go anywhere or drive to the emergency room. We're working to be able to reach people in the community where they are 24/7. So while we don't at this moment in time have our staff manning that phone through the night. You can still get reconnected to people in an emergency situation, and you still will be talking to mental health experts who are answering that line for now. And we're hoping by end of summer is sort of the timeline to have positions filled and that line answered right here at home with folks in our community.
Mike, before we go, I'm sure you're familiar with the ACEs test.
Yeah.
I'm sure a lot of those tests is ran on kids. A lot of kids that look like me in our neighborhood, it would be not the best results. At what number do you suggest the parents start to get these kids help?
Meaning if they do that 10 question questionnaire, yes. The adverse childhood experience.
Yes.
I wouldn't want to just use that particular test as the measuring stick that you need help. You could have a lot of those adverse experiences and be doing pretty good in your life, right? It doesn't necessarily mean that you will be saddled with health concerns or mental health concerns. So I want to distinguish that. That doesn't mean that it was an easy road for you. And it doesn't mean that you didn't struggle or won't struggle. So I wouldn't want to use it as necessarily the measuring stick, but if you're beginning to see those concerns, depression, anxiety, an inability to focus and concentrate, relationships are involved right, in a young person around you, I would more use a combination of those things. We can look at those 10 questions and we can probably know what of those have impacted our children or our adult children or us. We can look at those questions and we're going to know pretty well how it's impacted our family and others. And then the question becomes, how is it affecting their life? And are we seeing adverse effects? And then it's time to reach out. So I hope I'm not saying, hey, look, if you answer yes to 3 or 4 of these, your risk starts to increase for physical health concerns and mental health concerns. Be aware of that. But I wouldn't use it as the only measuring stick. You want to know that other things are happening. Plus, you wouldn't want to bring, say, yourself into treatment because you answered yes to those, but you're actually doing pretty good in your life. You know, it could be that way.
I know for me personally, I didn't know that I held a lot of stuff in that might have bothered me as a kid, and didn't realize it until I actually sat down with a psychologist at the age of 19 and 20. And when I sat down with him, I was trying to play the system.
Sure.
But he asked me some questions that I had never ever dealt with, and involuntarily tears started to come down.
Mm-hmm.
And so I believe that significant moment, it changed and made me a better point, because I realized that there were some things that was hurting me internally that I didn't realize that was really, really bugging me. And so from that point on, I started to work on those things. So I agree that maybe you can deal with it, to a certain point, but I don't know if I would have been a better person. I don't think I would have been the person now that I am if I hadn't seen that psychologist.
Right. And I would agree with you there too. If you're checking a lot of those boxes, there is no harm in having an assessment done or opening that door and taking a look. The other thing that I want to also talk to people about is that if you've experienced a great deal of trauma in your adolescence and growing up, or the recent trauma even that's happening, a lot of times people think that you have to go to therapy and you have to talk about all this trauma. And the reality is you do not have to relive that trauma. We're not here to re-traumatize you. We're here to work through things, but you don't necessarily have to drudge it up either. And sometimes that can be the roadblock for people is, but I don't want to talk about this stuff. That's not necessarily what treatment and therapy is about. We don't make you rehash it. We don't make you relive it. And we don't want to re-traumatize you. But you can still do treatment and you can still get better in your life. So good point, though. Good point.
Thanks. We got to do this more often. As you see, this is a lot easier. You can sit in your mansion and talk to us and still get informed.
I appreciate the opportunity. Thank you so much, you guys.
All right. Take care, Mike. Have a blessed
day. Take care.